Hi, welcome back to COPD Health Tips. Today we're going to talk about breathing. When you were young and before you had COPD, you really never thought a lot about breathing. You would just go about your business. Your brain would do all your breathing for you. The only time you really would ever control your breathing, and it would be limited control that you would have over your breathing, was when you're swimming or holding your breath when you're swimming or holding your breath because of bad fumes or smoke or dust or gases. And then you would just naturally start breathing again normally without even thinking about it. You walk down the street, you would breathe, and if you would get out of breath, you would sit down for a minute, catch your breath, rejuvenate yourself, get up, and keep going. But once you got COPD, as you notice, you get shorter and shorter of breath. It takes you longer and longer to recover when you get out of breath. And what you need to do is master your breathing and take control of your breathing more and more. Even though your brain will still have you breathing in and out, and you'll still get short of breath, the more you can control your breathing through exercise, the more you'll be able to deal with the shortness of breath. And with that, I included some pictures here that we could take a look at of your lungs, a couple x-rays, and a few other things that we'd like to take a look at before we started. And what we'll do is, after we look at that, I'll go over some exercises that you can do for your breathing to help you gain more control. Because the better control you have over your breathing, the easier it's going to be for you to control when you truly do get out of breath. So, without going any further, let's take a look at a couple of these pictures and x-rays. Okay, in this first x-ray, which you can see is a normal person's normal chest x-ray. The lungs are clear, and you can see they're well-rounded, and they have a good shape to them. Now this is a CT scan with contrast of my lungs. As you can see along the bottom, I have a lot of fibrosis, and it's working its way toward the top. And you can also see that I have nowhere near the lung capacity as the previous x-ray of the person that has normal lungs. I also have a wee little bit of hyperinflation going on too. Now this chest x-ray shows a person that has COPD with hyperinflated lungs. And hyperinflated lungs just mean there's air trapped in the lungs, which cause them to overexpand. When I have hyperinflated lungs, I have a real hard time breathing, and it makes obvious if no more air can get in there and you're trying to breathe in, then it makes it really hard to breathe. Now in this diagram, it shows that you actually, instead of just two lungs, you have 5 lobes, and they're labeled the superior, middle, and inferior lobe, and that's on the right side, and on the left side, you have the superior and the inferior lobe. And then you have the space in the middle there that you can see the notch is for your heart. Now this last diagram shows you a pair of lungs in the chest cavity and how the lobes are set up and where they normally lay in the chest cavity. So you can practice when you breathe, visualize that these lobes are in this area, 1, 2, 3 on the right side and 4 and 5 on the left side. And you can practice breathing in the different chambers. Hi. What I want to do here today is on this breathing video, I also wanted to include coughing, because a lot of people that do have COPD haven't properly learned coughing. And I decided to make this because seeing a person with COPD cough is a lot better than having somebody show you that's never had COPD before. So, I mean, they got the technique pretty well down, but and what you do, and what I do, is when I get up in the morning, I'm fairly congested, and sometimes throughout the day I'll get a little congested too, but not very much. And the way you do cough is you don't go go crazy. What you do is just a little bit at a time, like that, and take a rest, and just a little bit at a time. Now, once you master the breathing techniques, it gets a lot easier as far as getting the sputum and the mucus up, because you'll be able to feel pretty much where a lot of the congestion is. Unless you got a cold or you're getting an infection, then it's pretty much everywhere. But with me, I'm usually get it right in here, and the other side usually always pretty much stays clear. So what I do is I work on that side with the congestion. And see, I don't have to force it. I have to just a little bit at a time work it loose. And it comes up just like that. So I have a couple pictures too of the sputum that comes up. I know it's kind of gross, but it gives you a guide maybe to look, your sputum is fairly clear, has white. Now I was told, I don't know how true this is, maybe you can check with your doctor, sputum, when it's white, has white in it. Actually, those are dead white cells. Now, I don't know how true that is, but something to think about. I don't know if that's true, though. But when you cough, cough in different sections of your lungs. Now, that's on my left side. That's on my right side. You really can't tell, but I can feel it. And just cough like that. Take a break. Now, sometimes I do this in the morning and nothing comes up. And I'm not going to force it. I learned my lesson a long time ago about trying to force coughing. So, but amazingly, half an hour later, I'll be walking around and all of a sudden, there'll be a wad there. It'll come right up. So, but anyway, that's how you do the coughing. And hopefully that works out for you. Like I said, the better you master your breathing, way better off you're going to be. It gives you more control in so many ways. Okay, so here's two sputum sample pictures of my sputum that usually comes up. And as you can see, it's fairly clear. It's a little cloudy, but I contribute that to dust and air pollution and things of that nature. There's nothing really to get concerned about. Now, if yours is darker and turning green or yellow or has some blood streaks in it, you're really going to need to go see your doctor. Because the longer you wait, the harder it's going to be for you to get rid of the infection. So it's a good idea that as soon as you see some changes in your sputum, to make note of it. And if it gets worse, call your doctor and make sure you get it taken care of. And so let's get back to the main video. And thank you for watching. Okay, so what we've seen from the x-rays and the diagram, that you just don't have two lungs, you have actually 5 different lobes. You have 3 on this side, and you have 2 on this side, and then you have the space in the middle for your heart. And what you need to do with exercising is being able to control your airflow into each of those lobes. And the way to do that is through practice. And what you need to do, we'll try this first exercise where we'll try to get the air down to the lower 2 lobes down here. And in order to do that, you breathe in real slow and push your stomach out. Breathe out. Breathe in. Push your stomach out. Breathe in. push your stomach out. This is real good to start when you first start. If you're laying down at night before you go to bed, to lay down and just push that stomach out and let the air go naturally to the bottom two lobes. And then the next exercise you'll do is you get the middle lobe here and the upper lobe on this side. And you just breathe straight in. And do it slowly so you can actually feel the air. Now, you're not going to be able to completely prevent air from going to your lower lobes or your upper lobes, but you can direct the majority of the air with practice to that middle lobe and the upper lobe on your left side. And the last exercise you do is to bring all the air into the two upper lobes. And to do that, I did it quicker than you would usually do it, but you get the idea that you raise your shoulders up and you suck the air in and up instead of down and out through your stomach. And you work that diaphragm in and out and in and out. Develop the strength in your diaphragm so you can control your breathing better when you get short of breath. One of the things that causes short of breath is what's called a bronchospasm. Now, with a bronchospasm, you're getting good oxygen and your heart rate's good. And in order to tell that, what you do, and I got this when we first went in the hospital the first time, is they put a pulse ox on me. And I'm like, well, hey, how do you get one of these? And you can buy them on the internet, and you can get them in a drugstore, and it'll show your oxygen concentration and your heart rate. This is really handy to have because when I first started coughing and getting short of breath, I didn't have one of these, and I didn't know what was going on. I would panic, and I would breathe harder and faster and harder and faster. I was just actually making my situation worse because I was panicking, and as I was panicking, my bronchial tubes, my chest, and everything else would keep tightening up, make it harder to calm down and catch my breath again. But with the pulse ox, as soon as you start having one of these bronchospasms, you can look and see that your oxygen's okay, your heart rate's okay, it's just that your chest and you're having a spasm. Now, a lot of people right away, they'll just go ahead and grab their emergency inhaler, whether it's Sopanex or albuterol, and Benylin, and go ahead and take a couple puffs of that. But if you're still getting good oxygen and your heart rate's still good, if you just slow down and relax, breathe slowly in, slowly out, try to get the air to go down to them lower lobes, slowly in, slowly out. Monitor your oxygen on your pulse ox. In and out slowly. And eventually, the bronchospasm will pass. The majority of the time it does, unless you're getting pretty sick. Then you do need help. You need your emergency rescue inhaler. Or if you are getting really sick, then you'll have to use a nebulizer or go to the emergency room. It's something not to play around with, but once you master your breathing and have pretty good control on relaxing your chest muscles and your bronchial tubes and your lungs, when you do have a spasm, you're pretty sure that it's going to pass if your oxygen and your heart rate's okay. If your heart rate and your is okay, but your oxygen starts to drop, then yeah, definitely go ahead and use your rescue inhaler. and that should take care of it. But once you master these and the breathing and have more control, the better off you're going to be. So it's something to practice. And you can practice walking down the sidewalk. You can practice it on a treadmill. I have a manual treadmill. And I like the manual treadmill better than the electric because on the manual treadmill, you have to work. You have to work your legs, you have to work your butt, you have to work your muscles to get the thing going. Whereas an electric treadmill, it'll just pull you along. And the hardest part about an electric treadmill, too, if you start having a breathing attack on an electric treadmill, it's pretty hard to get off. You can get off, but it just makes it that much worse. And it makes your breathing attack even worse. So at least on a manual treadmill, if you start getting short of breath, you could stop right away, and the treadmill is going to stop right along with you. So that's why I like the manual treadmill. But we'll go into more of that later with the different equipment and other exercises that we can do. So one more thing I'd like to tell you is, and invite you, we've created a forum, and it's COPD Help Group. That's www.copdhelpgroup, and we'd like you to join. And you can talk about your COPD. You can talk about whether you're sick and tired of being sick and tired. You can talk about anything you'd like to talk about. And, I mean, don't worry if there's only a couple of members because we're just pretty much starting out. So go ahead and sign up anyway. And we're not going to bomb your email with a bunch of ads or anything else like that, or we'll even bother you. We'll send you one email so you can set up your password and have your privacy. And like I said, it's anything you want to talk about. You're more than welcome to join. And we hope you do, and I hope to see you there. So if you have anything you want to talk about, medications, breathing, if you're having trouble with cigarettes, feel free. Join up and we can have a discussion. There'll be other people there just like you, and maybe you won't feel so alone. So it's a good thing to have. I want to thank you. Thank you so much for watching COPD Health Tips. And we're going to have more videos coming out, so I hope you stay tuned. Thank you. Have a good day.